Hello, everyone. Thank you for joining us today for this month's Survive and Thrive session, Is Something Keeping You Awake? Managing Sleep Issues After Cancer Treatment. My name is Catherine Viola Kissinger. I will be the host today. I am an outpatient social worker at the Independence Family Health Center and work with our oncology and radiation patients during their treatment and into survivorship. I have the pleasure of introducing our presenter for today's session, Dr. Melissa Walt, a clinical psychologist in the Department of Palliative and Supportive Care at Cleveland Clinic's Taussig Cancer Institute. Dr. Walt has been with the Psycho-Oncology Service at Taussig Cancer Center since October 2019. In her role, Dr. Walt provides psychotherapy to cancer patients at any point in their cancer journey. She offers therapy to those who struggle with adjustment to cancer and the side effects associated with cancer treatment. Dr. Walt also provides support to cancer survivors, those who have completed treatment yet continue to experience challenges in post-treatment survivorship. She is here to talk about ways to optimize sleep using a cognitive behavioral approach called CBTI. CBTI has been coined as the gold standard intervention for treating insomnia among cancer patients. I will now turn things over to Dr. Walt.
Great. Thank you so much for the kind introduction, Kat, and to all of the viewers of this presentation. I appreciate you taking an interest, and I hope that you find this information to be valuable and helpful for you, and that you are able to get a good night of rest. I have no financial interests or relationships to disclose. I want to just do a brief review about the information that I'm going to be sharing with you today. I'm going to start with just offering some basic information about sleep and talking about why sleep is so important. I'll then move into introducing insomnia disorder. And the DSM criteria, which is how we, as providers, diagnose insomnia in our patients. I'm then going to talk about and help you understand how cancer and treatment for cancer can impact sleep, and then move into giving you some information about cognitive behavioral therapy for the treatment of insomnia. I then want to kind of focus the information on how to improve or manage fatigue during the day, and how to some cognitive and behavioral strategies for navigating fatigue. I'll then briefly just talk a little bit about pharmacotherapy for treatment of insomnia, and then we will wrap up with some additional resources and tools that you can use as you practice these tools and strategies on your own. So to begin, some basic information about sleep and really why sleep is so important. Sleep is really an essential physiological process that supports healthy brain function and physical health. When we sleep, our heart rate and our blood pressure drop, giving our hearts a chance to rest. Sleep is so important for immunity. It strengthens our immune system and our ability to fight infection, which, if anybody on the call has a personal history of cancer, or your loved ones, or even experience insomnia yourselves without a history of cancer, you might be able to relate to that being able to fight off just a common cold or any bugs that are being passed around. It's really important to get a good night of sleep in order to heal. Sleep can regulate our hormones that affect hunger and appetite. So conversely, poor nights of sleep can make it harder for your body to use energy efficiently. And then finally, sleep is so important for our mental health and our cognitive functioning. During sleep, we are able to kind of consolidate or file memories. We can process information better after a good night of sleep, and it helps with problem solving, just to name a few. There's a lot of information on this slide, but I wanted to take the time to just kind of give some information about what we look for when we are diagnosing an insomnia disorder. These are the criteria that come directly from the DSM, which is a manual that healthcare providers, psychologists, and psychiatrists we use to diagnose insomnia. So it basically comes down to if you are having difficulty sleeping and you are dissatisfied with your sleep quality, a person would report one of the three bullet points listed here. So you're either having difficulty initiating sleep at the beginning of the night, you're waking up a lot in the middle of the night, so you're having a hard time maintaining sleep, or you're waking up early in the morning without an ability to return to sleep. And early in the morning means you're waking up even before you intend to, or before your alarm, without really wanting to. So these are the three things we look for, and you can either have one of these things, two, or all three. These sleep difficulties would have to occur at least 3 nights for the last 3 months or more. Again, we are looking for, does your sleep disturbance happen more often than not? Does it cause significant impairment in your ability to function during the day, whether that be, just taking care of your day-to-day at home, work-related tasks have become more difficult. Even being able to kind of show up in your social group or perform academically. These are some of the things that we look for. And then it's important to also note that insomnia, when we are looking at, trying to find evidence for diagnosing this disorder, we look at, do folks have an opportunity to sleep or for sleep, and yet sleep does not happen easily. And that's an important distinction to make. And then for the purposes of this presentation, insomnia really is what we are focusing on today. And any other sleep disorders are kind of beyond the scope of this presentation. So the reason that most people are viewing this presentation is because you or a loved one has been diagnosed with cancer and may be experiencing difficulties with sleep, whether that be while on active treatment or even after treatment ends. And I just wanted to give some information about how prevalent insomnia really is among cancer patients. It affects 30 to 60% of adults who have been diagnosed with cancer at any point in their life. Sleep can improve after cancer treatment ends, but as I just alluded, it can also persist even after after treatment ends. So in that post-treatment phase, for months to years. And so it's so important to always be, mindful of your sleep and talking about sleep with your providers, even if they aren't asking. I encourage you all to bring sleep up in your conversations, especially if you are struggling with it. I thought it was important to kind of give some information about what causes insomnia? What makes it kind of linger, or what makes insomnia become a chronic condition? So we look at a lot of different factors when we are diagnosing, assessing, and treating insomnia. And some of those factors include like the physiological components, like, you know, medical issues, family history of sleep issues, specifically insomnia, female gender, age. All of these are physiological factors that put somebody at higher risk, or people are more likely, if they fall into these categories, to be diagnosed with insomnia at some point in their lives. The psychological factors would include things like anxiety, depression, often comorbid with insomnia disorders. Behavioral factors could include things like poor sleep hygiene, and we'll talk about many of these things in more detail in the next few slides. Of course, there are environmental factors as well that play a role in kind of the creation of and the maintenance of insomnia. And so it's thinking about, you know, is your mattress comfortable, or is it too soft or too hard that it's keeping you awake at night? Is there a lot of noise in your sleep environment, whether that be immediately in your home or your room or even outside? You know, people in big cities might hear traffic a lot or trains passing by, which wakes them up, and then they get into that cycle of not being able to return to sleep for whatever reason. And any of these factors can kind of fall into the last three bullet points. So predisposing factors would be things like I mentioned before, there are many things that can put you at higher risk for developing insomnia at any point. As it relates to our cancer population, there are higher rates found among patients with breast, gynecologic, and lung cancers. For precipitating factors, these are things that trigger insomnia. So maybe you have these predisposing factors like female gender, older age, a family history, you have a history of anxiety or depression, yet you've never experienced a sleep problem. When someone is diagnosed with cancer, though, things can change, and that can be the precipitating or triggering factor, is that you were diagnosed with cancer, and we all know what that means and what that entails. There's a lot of worry thoughts, a lot of uncertainty, a lot of moving parts just in figuring out how to kind of shift our responsibilities throughout our family, and all of that. Fear of recurrence. That's a worry thought that pops up a lot. You know, the side effects from treatment can trigger insomnia. So it's important to think about that. And then, of course, perpetuating, or factors that maintain insomnia. So these can be things like continuing to take daytime naps. When you're snacking a lot on sleep during the day, that interferes with your ability to sleep as well or as much at night. Maintaining poor sleep hygiene behaviors can keep insomnia kind of going as a chronic condition. Caffeine, alcohol, and other substance use can certainly maintain that insomnia as well. So moving on to talk about cognitive behavioral therapy for insomnia. And like Kat said at the beginning of the presentation, this is really, excuse me one second. Cognitive behavioral therapy is, or has been coined, the first line of treatment by the NCCN, which is the National Comprehensive Cancer Network. CBTI is preferred over pharmacologic interventions, which means even over medications, CBTI has been found to be the most effective. in addressing those factors, those underlying those underlying things that are maintaining chronic insomnia. So the components of CBTI, there are quite a few, and it goes way beyond just general sleep hygiene. It includes stimulus control, which I will talk about at the next slide. But this is really just making sure to keep your bed or your sleep environment, reserving it only for sleep and intimacy. Anything else that you are doing should be done outside of the bed or bedroom. Sleep restriction is kind of as it applies. It's holding off on sleep until your sleep, your desired sleep time. So this would be like, cutting down on or limiting your daytime naps during the day. I use the metaphor of snacking on sleep will lead to you not being as hungry for sleep come that big meal time or that longer sleep time. And then of course, relaxation training is certainly a component of CBTI. It teaches you relaxation and ways to kind of let go of any tension or stress that you've been carrying around with you throughout the day that's kind of piled up. And so actively, as part of your bedtime routine, making sure that you are practicing some sort of relaxation exercise, yoga, massage therapy, essential oils, using all of those things that promote relaxation. And then, of course, cognitive therapy is a very important part of this treatment intervention. Cognitive therapy addresses the maladaptive or unhelpful thoughts about sleep that may be increasing arousal or preventing you from being able to sleep and get good restful sleep. Oops. Sorry about that. Okay, so this next slide is kind of hashing out all of what I've just spoken of as far as the components of CBTI. So these are the kind of nitty-gritty details about some of the things that we might talk about if you are in a sleep therapy session. So some of these tips would include maintaining a consistent sleep schedule. It's much more important to maintain a consistent schedule for your wake time versus your bedtime. And the reason being is you start your clock at the same time every day, which gives you an opportunity to build your sleep drive or your hunger for sleep so that hopefully come bedtime, you are becoming sleepy around the same time. Sometimes though at bedtime, you're not always ready for sleep. Your body's just not quite there yet. And so it's important to really be mindful of and check in with yourself around whether, you are ready for sleep, or maybe are you just fatigued or kind of run down from the day that you just had. If you get into bed earlier than your body is ready to sleep, there is a likelihood that you may just end up tossing and turning and spending a lot of time in bed, becoming more frustrated that you can't fall asleep when you want to. It's really about letting sleep kind of naturally unfold. On that note, if you can't fall asleep within about 20 or 30 minutes is the rule of thumb, getting out of bed and returning when your eyes are so heavy that you have little to no doubt that if your head hit the pillow, you would fall asleep. Creating a comfortable space, somewhere other than your bed, whether that's in your bedroom, there's a chair or a couch, or another room completely. And using this space as somewhere where you kind of practice and engage in relaxing activities to kind of prime you for sleep. Like I said before, using the bed only for sleep and sex. If you're eating in bed or reading, I take that back. If you're doing work or, paying bills or something like that, those would be activities I would suggest doing outside the bed. But if you're reading a novel or something that, is calming and relaxing, reading in bed is fine. Creating a buffer zone. So this is a bedtime routine. I tell a lot of my patients that, just as when we were kids, or if you have kids of your own, require a bedtime story in order to kind of cue them for bed or for sleep. This is a sign that, we're starting to settle down and wind down for the day. We need the same thing. We need reminders. We need a routine, something to help prime us for the night of sleep ahead, rather than jumping from, the busyness of our days right into, okay, now I'm in bed and I'm going to try to sleep. It often does not happen that easily. Avoiding daytime napping for the same reasons that I have spoken of already. Again, thinking about it in terms of, if I am snacking on sleep a lot during the day, I am going to be less hungry for it when it comes bedtime. The cognitive therapy really kind of addresses unhelpful beliefs about sleep. So a lot of times people will come to me saying, that they're, as soon as they step into their room, their bedroom, and see their bed, they automatically become tense, and start thinking about, okay, here we go again, another restless night of sleep ahead. And just recognizing how that narrative, that dialogue can really impact your sleep. Scheduled worry time is another strategy for worrying efficiently. So as cancer patients, you might have a lot of worries kind of moving around in your mind at all times, a lot of uncertainty, thinking about, those routine scans that are coming up, or even thoughts about, if cancer came back, how would my family fare without me? So, there's a lot of thoughts going on. So scheduled worry time can really be an opportunity for you to think about all of the things that are going on in your mind and that you're worried about before bedtime. And as you are consistent with this scheduled worry time, you become better able to say to yourself, I've put my time and energy already into worrying about these things today. I've done what I can to take good care of myself despite these worries. And now is time for sleep, and I will return to my worry time again tomorrow. It sounds kind of hokey or cheesy at first, I'm sure. But I've really seen a lot of patients benefit from having this time to worry, and worry intentionally and on purpose, rather than it showing up at really inopportune times. Relaxation training, meditation, and yoga is part of CBTI training as well. Again, it's about training your mind and your body to relax, which is a key ingredient for sleep. Light therapy is often recommended, especially for folks that may live in where winters are very long, Northeast Ohio, for example. I don't use that as much. I will say that, but I have seen benefit for folks more with like a seasonal depression, has certainly been effective. Turning the clock around and avoiding any clock watching, especially during those wake times in the middle of the night, that can certainly start you on kind of that cycle of, those worry thoughts. What is the doctor going to tell me tomorrow? Or When is the pain ever going to go away? Things like that. So turning the clock around will help you not to think about how much time left do I have before I have to wake up and get my day started again. And again, just letting sleep kind of naturally happen, and being patient with yourself in the meantime. Limiting your screen time before bed is really important. That's part of sleep hygiene. Putting your television on a timer if possible, so that you don't have to worry about getting up and turning it off in the middle of the night. We always recommend stopping any caffeine intake by 2 p.m. It takes several hours for caffeine to eliminate from our systems. So if you are drinking sodas or coffees, energy drinks, things like that before or close to bedtime, there's likely caffeine remaining in your system when you're trying to sleep. So avoiding that. Also limiting or avoiding alcohol or drug use, as our bodies try to metabolize, especially alcohol. It's a very awakening, arousing kind of process that it's hard to get good restful sleep. Exercising regularly is also important. This helps to increase our sleep drive. So we're kind of spending fuel, spending our energy during the day so that we're setting ourselves up for a good night of sleep. And, also recognizing any limitations that you may have as a result of cancer treatment. Setting your expectations to be realistic. When I talk about exercise, I think that anxiety starts to kind of come into the forefront. Nobody's expecting you to train for a marathon. That's not what this means. But if you can find 10 minutes a day just to stretch or do some chair yoga, or just move from another seat in your house, and get some steps in that way. That is spending good fuel during the day. Having a comfortable room or a space to sleep is really important. Comfortable mattress, I was going to say well lit, but a dim or a dark room. If you need a night light for safety purposes to get you from the room to the bathroom, by all means. But having a comfortable and a peaceful place to sleep is really important. And like I said, be patient with yourself and with the process, and recognize that sleep will happen when it happens. If we had a light switch to turn on and off sleep, I wouldn't be giving this talk right now, and I might not have a lot of patients in my office complaining of sleep problems. So if it was that easy, but it's not. So reach out to us for support if you find that you are struggling or that you want it. So a quick note about fatigue and ways to manage fatigue. It's such a common side effect, especially after cancer treatments, including chemotherapy, radiation, immunotherapy, surgeries even. And I'm not talking about just after you finish or during the treatment. Like I said earlier, fatigue can linger and it can last and become a really chronic condition for cancer patients months to years after you have completed treatment. And so some ways around that, or some ways to kind of navigate fatigue, is to plan ahead and really kind of schedule breaks. So doing a lot of self-monitoring is a big part of my practice, and offering information to patients about keeping a diary daily of times when you feel like you have the most energy, even if it's a couple minutes in the morning or mid-afternoon. prioritizing your energy. So what this means is, taking the rest, listening to your body when it says to, to stop, making sure that you do that so that you're kind of, you're able to kind of reset, recharge, and potentially have energy to do whatever it is you need to get done that day. Pacing activity is really important. We talk a lot about time-based pacing in my practice. And what that means is instead of, identifying a goal and getting started on that task and just powering through from start to finish, setting smaller goals based on amounts of time. So saying, I am going to work on this thing that needs to be worked on for 10 to 15 minutes, and then I'm going to take a break after that time. After the break, you can either return to that task or onto something else. It's a good way to kind of hold yourself accountable for being more productive, more efficient. It allows you to address more than one task. So you could spend hours and hours on one project or one thing, and you have neglected everything else that needs to get done. Where if you practice the time-based pacing, this is a good way for you to kind of address little by little more of that to-do list that you may have. Don't be afraid to delegate work to others. Ask for help when you need it. Accept when help is offered to you, even if you don't need it. Sometimes you just want it, and it would take one thing off your plate. So don't hesitate to say yes if somebody reaches out and offers help. Adjusting your expectations is really important for fatigue as well, or for managing fatigue. It's, something is better than nothing is a good motto to live by. Setting the bar a little bit lower than you typically might, maybe more realistic and achievable than saying, oh, before cancer or before treatment, I was able to function or do this thing at XYZ level. Maybe that's just not realistic anymore. And instead of setting that bar so high, but never being able to achieve it or reach that goal, and then ending up frustrated by that, set the bar a little bit lower and see what you can accomplish or achieve. And then from there, you might adjust or increase your expectations. Nutrition is really important. I always encourage patients to consult with nutrition, making sure you're staying, you're getting the nutrients and the supplements that your body needs to function at its best, staying hydrated, drinking a lot of water throughout the day. Stress management is a really good way to manage fatigue. Again, kind of thinking about this as a balancing act between productivity and rest. And how can we be as productive as we want to be if we haven't given ourselves a chance to recharge? Acupuncture has been very well researched for cancer-related fatigue. We talked about physical activity and exercise, but exercise can be really helpful in regards to just kind of energizing you and giving you that second wind. It's kind of counterintuitive. You would think if you're feeling fatigued, that more rest and just being kind of sedentary would be the ticket for improving that, but it's actually the opposite. And we have found that being more active and just getting up and moving for a period of time can give you that energy to continue on with your day. Massage therapy is another well-researched kind of mind-body therapy that has been shown to help with fatigue. And then, of course, we've been talking about all along psychotherapy, cognitive behavioral therapy specifically. And just a brief note about medications. So there's certainly a time and a place for medications. It's very helpful. As a psychologist, I do not prescribe, I don't manage medications. But in the beginning of this presentation, we had already established that when it comes to insomnia and getting to kind of the underlying causes and kind of the root of the problem is really best done through all of the interventions that I mentioned before earlier. And medications really are not the first line of treatment when it comes to insomnia. They can be very helpful as supplemental. So if you're doing CBTI or any other intervention to address the insomnia and medication management, you are likely to get good benefit. But I would recommend that you just consult with your medical providers and talk to them about what medications might be best for you and what treatment course would be best. So I wanted to offer some additional resources as well. This is just a handful of resources, ones that I use the most often, but there's certainly more out there. So feel free to kind of do your own research and browse online for whatever it is you might come across. But some phone apps really have been kind of a convenient way to practice relaxation training specifically. So Calm and Headspace are very common phone apps that I have heard patients have a lot of success with and really benefit from. Just being mindful that, I think there are in-app purchases for both of them. I think you can download Calm and Headspace for free. But then again, to take advantage of all of the subscriptions that are available in those apps, it does require payment. Same with Simple Habit. UCLA Mindful and CBTI Coach are free. All of the information in those apps are free of charge. They are actually apps that have been created by the VA, so Veterans Affairs. And they are helpful for both veterans, but also civilians to use. YouTube is a wealth of information. So just knowing the keywords like relaxation training or deep breathing or meditation exercises, things like that will bring you to some really good pre-recorded audio and visual recordings. I stumbled upon this band called Marconi Union just a couple of years ago. And their playlist is called Weightless. They have actually been in medical journals, which is pretty cool, and have been the studies using their music have been found to have great impact on lowering blood pressure and all of those other physiological symptoms that accompany anxiety. And like I said before, relaxation is one of the ingredients to good sleep. So every once in a while, I will turn on my Spotify account and listen to one of these songs by Weightless. It's free of any lyrics, and it's mostly instrumental, very consistent, smooth sounds to listen to. The other thing that you can do on Spotify is just pull up sleep sounds, and there are many playlists that meet this criteria. So you can listen to that and just kind of turn it on quietly and have it playing all night. It doesn't have any like loud noises or anything that might interrupt your sleep. Sometimes when I use the sleep sounds at night, I wake up in the morning and it's still playing. So just having that on as background noise can be really helpful. And then, of course, American Cancer Society, the National Cancer Institute, and the National Comprehensive Cancer Network, their websites offer a lot of really good information for cancer patients, both in active treatment and post-treatment, for managing other symptoms and side effects, longer-term side effects. So I encourage you to check those websites out. And for anybody in the Cleveland area, which is where I am and where I am giving this presentation from today, the Gathering Place and Stewart's Caring Place are really good resources to have in our community, offering cancer support to our patients, as well as family and friends, loved ones. So that brings us to the end of the presentation, and I just want to thank you all for listening in, tuning in today. Again, I hope that this was helpful information. If you have any questions, I believe that there is a way to reach out to us, so please send them our way. Thank you.